nasal cavity. This whole thing here is a nasal cavity. Makes sense so far? Alright. The next one is the conchas and the meatus, right? So these are the conchas, 1, 2, 3. A, B, C are conchas, and the grooves are the meatus. So how do we say that? We say superior nasal concha, right? Concha is right here, C-O-N-C-H-A-E. Middle nasal concha, inferior nasal concha. Superior nasal meatus, in middle nasal meatus, and inferior nasal meatus. Okay? Internal nares, of course, is the whole here goes internal, okay? So right here be the internal nares. The auditory tube opening, we have a tube. Right here, auditory tube opening. That's the one that the ears, the throat, the nose is all connected by this. And when we swallow, it balances the pressure. Next one is the pharynx. We have the nasopharynx, the oropharynx, and the laryngopharynx. Next one is the hard palate. The hard palate is in the oral cavity. This region right here is the hard palate because it has the bony prominences. The remainder in the back is the soft palate because of the musculature. So if you take your tongue, stick it in front, it'll feel hard. That is the hard palate. Stick it all the way in the back, it'll be much softer. Okay, so again, hard palate and soft palate. Then followed by the uvula. Okay, so the uvula is right here. We also have the sphenoid sinus. Okay, so the actual sphenoid sinus. This is it. This is just in case it's a frontal sinus. The next thing is a crubiform plate. This right here is the crubiform plate. Crubiform plate. All the tonsils. This is the pharyngeal tonsil, the palatine tonsil, and this will be the location where we're going to find the lingual tonsil. So again, pharyngeal, palatine, and lingual tonsil. Okay, next one is the hyoid bone. Right, we see piece of the hyoid bone here, but the hyoid bone is special because that bone doesn't articulate with any other bone. This is the hyoid bone also. The next thing is the larynx, right? The larynx is this whole thing here. This whole big thing here is the larynx. Or this whole big thing right here is the larynx. What does the larynx does? It houses the voice box, okay? So inside the voice box, of course, we have the vocal cords. Next one, thyroid cartilage. I'll specifically point it. This is the thyroid cartilage. This is the thyroid cartilage. This is also the thyroid cartilage, okay? The next one is the laryngeal prominence, right? That's the Adam's apple, right? Okay, in some individuals it's more prominent than others, okay? Why you guys don't have one? Do you guys have one? Do you have one? You don't have one? Everybody has one.
It's less prominent.
Less prominent than females, okay? So don't be shocked if you see a female with one. Well, it happens. It happens in Atlanta, I forget. Okay, laryngeal prominence. Okay, laryngeal prominence. And again, this is a hyoid bone. Right? Right about here, where it bends here, here should be the laryngeal prominence in this one. Next one is cuniculate and arytenoid. Okay, so this right here is the cartilages. Right, there's a pair of them. See, it looks like a beak. So this here is the arytenoid, and this here is the cuniculate. So two parts of it, the arytenoid and the cuniculate, okay? Next one is the cricoid cartilage. This right here, of course, is the cricoid cartilage. Okay, and this model right here is the cricoid cartilage. Alright. Now the cricoid cartilage is anterior to posterior, right? So I could really say that this portion too is also the cricoid cartilage, but the posterior aspect of it. This here is also cricoid cartilage. Okay? So it could run from the anterior to the posterior. So this also can be considered to be cricoid cartilage. Next one, the epiglottis. See this blue right here? This is the epiglottic cartilage. So if we close this down, right, we protected what? The glottis. So food doesn't enter into the trachea. So again, this is the epiglottis. In this model, this flap is the epiglottis. Okay. Next one is the helium. Okay. The helium of any organ is the point that the vessels enter. So for example, this point right here, this whole big area here that this is entering, this is called the helium. Okay. Now you can see it a little better here, where the vessels actually enter the lung. So all this whole region here is considered to be the helium or hilus, same thing. Now the superior left lobe, inferior left lobe, superior right lobe, middle right lobe, inferior right lobe. I know you guys are aware of it. So let me just look at this. What would you call this here? Right? Superior lobe of left lung, superior lobe of, this is superior lobe?
No.
No, right? So this is the inferior lobe. It's missing the middle lobe, right? Remember, the right lung has three lobes. The left has two. Okay. Okay. So these right here, right? If you notice, right, this one has only two lobes, but this one possibly has three, right? So this is the superior lobe of the right lung, middle lobe of right lung, and this is a little piece of the inferior lobe of right lung. Now, we have to know these fissures, okay? What do you think this fissure here is called? Oblique fissure, okay? Oblique fissure. And this right here is the transverse fissure or horizontal fissure, same thing. Now, we did the various bronchi. We studied the various bronchi. We say here is the trachea, right? But the last cartilage before it bifurcates is called the carina. So this here is the primary bronchi, right? So left and right primary bronchi. So what about this? What would this be called? Secondary? Let's check it now. Primary, secondary, and what's this going up? Tertiary. Do you see? What about this one here? What about this one here? What is this called? This one right here. I don't know if you can see it. Yeah, better. Okay, let's see. Primary and secondary, right? Still secondary. And when it branches about here, it'll be the tertiary, okay? And these are the bronchioles and so forth, okay?
Look at the picture that I sent.
Okay.
Hey, would y'all mind keeping it down over there, please?
Okay, so the next one we have is the thyrohyoid ligament, the cryohyoid ligament, and so forth. It's easy to do these, right? Because the thyroid is here, we say thyrohyoid ligament. We're done. Right? Thyrohyoid ligament. Okay, the other one says cricothyroid ligament is right here. Right? Cricothyroid ligament. Last one is cricotracheal ligament. That's these right here. Okay? Right? And these are called what? Tracheal cartilage. Okay? Tracheal cartilage. Okay, so now we have the vocal cords. On this model, normally has the vocal cords here, but it's all torn up, right? So make sure and look at the other model. But in this model here, we have the vocal cords. Right? This is the false vocal cord or the vestibule, and this one right here is the true vocal cords. Okay? Next thing you have to identify is the diaphragm, right? So here's the diaphragm, right? So that's the diaphragm that we see there.
Could you show the diaphragm one more time?
Right here, at the base of the
right.
lungs, you should have the diaphragm. Okay, next one, we saw the tracheal cartilage. We saw that this right here is the trachea, and all these are the tracheal cartilages, right? Next thing is the apex and the base. Right, this right here is the apex, and this, of course, will be the base of the lungs. We mentioned carina already. Right, this goes this way. And notice you can see that notch there, right? So that is the cardiac notch. Okay. Now we also have another model. Could we borrow that? Borrow that for this?
Over there. Okay.
Yeah, that one is flat. Okay. So just in case, what would you call this right here? Tertiary, right? So let's see if it's true. Primary, secondary, tertiary bronchi, right? Okay, what are these right here? They're bronchioles, right? Just making sure. Now this one asks the visceral and parietal, right? We say immediately covering the lungs. As a visceral, right? Pleura. The parietal pleura interfaces with the body wall. This is the body wall. So this right here is the parietal. And this space here is the? So the space is the pleural cavity. Okay, beautiful. Okay, the next thing we asked to find is the pulmonary arteries and veins. Well, we know where that is, right? These are the pulmonary arteries and veins. Okay. Next thing is the terminal bronchiole. This is something we discussed in our lecture class. We have we have the terminal and respiratory bronchiole. How do you determine the difference? Well, the terminal bronchiole comes first, and if the bronchiole attaches to the alveoli sac, then we say this is the respiratory bronchiole. Now this has been cut, so I'm assuming that an alveoli sac goes there, an alveolar sac goes there. So again, this one will be the respiratory bronchiole, and this one will be the terminal bronchiole. We also see a duct. Okay, this here is the alveoli duct. Okay, alveoli duct. Now, one of these will be what? The alveoli. Okay, but the whole group of them will be the alveoli sac. So if you see a little circle that shows you a whole bunch of them there, little circle, what would you call that? Alveolar sac. But if it just points to one, you're going to call it the alveoli.
How would we know if it's pointing to a wide space or just to an individual one?
Yeah, I just said you'll see a whole big circle thing around it. Whole big. They use maybe a gun cleaning strip. Let's see if I have one here. Yeah. They can do something like this.
Gotcha.
All right. The same thing they can do this too. All right. So you know exactly what they're talking about. All right.
That's the hilum
Yeah, hilum
or hilus.
or hilus. Yes, my dear. Okay. Okay. Now the respiratory volume. I know you may have covered this in your classes. If you're in my class, you have already covered this, right? Remember what tidal volume is, right? Right. In breathing in and out, and then if you take a breath above the tidal volume, is the inspiratory reserve volume. If you breathe below the tidal volume, right, expiratory reserve volume. Okay, so go through this list. right here if you have any questions, ask. Now, there are only two slides you're looking at. One is the lungs, really easy, and the next one is the trachea, and there are pictures and books in your books about this. All right? So if you have any questions about these two slides, let me know. Take 5 minutes, finish the slide, and I'll come to you, okay?
Thank you.
All right.